everybody, it's your girl, Charlotte Van Horn, Black Expats in Panama, and I'm coming to you on behalf of my Black Expat Journey podcast. I was doing Blackset Radio for quite a while, and Blackset Radio has taken a hiatus, but that's okay, because while we were doing Blackset Radio, we were also doing my Black Expat Journey podcast. So I'm still here. We still live. You can find me everywhere, iHeartRadio, what is it? iHeartRadio, Apple. I'm on Elite Conversations, podcast media channel, all kind of places. I can't keep up. Okay, so but y'all find me. You will find me. But anyway, just as with the blacksetradio.com platform, I'm always bringing super duper awesome guests to you, because you deserve the best. Today is no different. I will be introducing my client, sister, friend, Alicia Smith. Alicia is going to be talking to us about healthcare for expats, information about healthcare for expats, particularly in this case, Black expats in Panama, and about a provider guide that she is working on. Is that correct? Am I right?
No, you're absolutely right. It's a guide for us.
It's a guide for us, and I'm so excited. As always, I'm going to be learning more about this today. Alicia and I have been talking about it for months, but I'm really, really excited to just kind of see the whole comprehensive thing come together during our conversation. I'm going to allow her to introduce herself, okay? Because can't nobody do it like you, baby, okay? But I do want to say this. I want to say that Alicia and her husband and Ava came too, right?
Yes, she did.
They came on beat number 10. That was 3 years ago, June of 2022. And we have just been connected to the hip since then. You are like one of those stories that I love to tell when I say that the Beat Cultural Relocation Tour is so much more than a tour. It is, because you come, we become family, and we just, we support each other. We've seen each other so many times. You've been back to Panama so many times. And so I'm just so excited to have you here today. And so let me go ahead and turn it over and let you introduce yourself to us, Miss Smith.
And this is so funny because we know each other. So I'm going to introduce myself to you in a way that I usually don't care to, because I don't like to talk about work when we're hanging. Right. I like to do what we do and learn about Panama. Mm-hmm. But I'm Alicia Smith. I am based in Columbus, Ohio. I'm a native Daytonian. Lived in Columbus for the past 34 years or so. I came to Columbus for grad school, went to Central State undergrad, and got into Ohio State. We can talk about that at a later date in the program that I ended up joining because of representation. And at that stage in 91, we didn't call it DEI, but the reason that I got into the healthcare program that I got into was because somebody identified me and pulled me into the space. So I have been working as a healthcare consultant for the past 25 years. I've been in the healthcare space since 1995 and have always dedicated what I do to my clients, my employers, but for the past 25 years, my clients specifically. And I help whether it's state, federal, local government, healthcare provider, trade association, foundation, managed care organizations. I help them accomplish whatever their needs are. And I think it's high time after all of these years that I use what I've done for clients for myself and for the rest of the expat community.
Let me ask you this. So why healthcare? Is it any story behind that, or how did you end up in healthcare?
I was always wanting to go to law school. I was a political science undergrad. I loved history, government, everything about it. And I said, I'll just go get my Master of Public Administration. I had no interest in healthcare. Healthcare, people in my family were in healthcare as nurses, and my mom worked in a hospital, but there was nothing about healthcare that particularly intrigued me. But when I went to like an open house at Ohio State, the Ohio State University, I was in the line. I was up there for the weekend for a program for future public administration graduate school enrollees. And I will never forget standing in line and somebody just tapped me on my shoulder, older Black gentleman, and his name was Dr. Harold Logan. And he asked me if I would be interested in coming to this other table on potentially looking into healthcare administration. And that line was shorter. And I'm like, okay, this line will take a while. I'll go back and get in that line eventually. So I went over to the table. It was shorter. And I put my name down. And a couple weeks later, I got an acceptance to the program with a fellowship, first full year of grad school paid for, and I got money in my pocket. So that's how I got into healthcare.
That is awesome. So did you ever go back to that line?
No, I did not, because even just talking to them and they explained what it is that the program was about, I'm like, well, this is exactly what I like. It just happened to be in healthcare. And it was intriguing. I'm like, okay, you sold me. Thank you. I have what I need. So I never got back in that other line.
So what year again was that, Alicia?
This was in 1991.
So when they explained to you what the program was about like it was writing policy and administration?
At that point, the program was called Master's Degree in Hospital and Healthcare Administration. But we did talk about the policy aspects of it. A lot of people were either hospital CEOs at that time, mostly white males, and some Black males, but not a lot. Nursing home administrators, people who worked in the federal government on healthcare policy. I'm like, okay, well, that sounds kind of interesting. I think I could do that.
That's so interesting because I used to work for doctors. I was like an admin, medical legal secretary, paralegals, all my, corporate life. And I met a doctor there and he went through medical school. And he went through medical school only to find out that he, reading about it in the books was one thing, but the actual application was another. He got through his, I guess, residency or in residency, right, for doctors, so that he could get his MD, but he became a corporate level doctor. And I was very young at the time when I used to work for ER Scribb and Sons, soon to be Bristol Myers, they turned. And I had never thought of a doctor from an administrative perspective. And you're talking back, and this was the 80s when I, became aware of that. But you're talking the 90s. You're talking a Black woman, a young Black woman, pursuing a college career. And when you say healthcare, everybody thought you was going to school to be a nurse, right?
Absolutely. Absolutely. Had no idea. And no idea what it even meant. And at that time, the program only enrolled 25 students. I don't know what happened that year. And it usually is, again, white men. The year that I was in the program, there were 25 students. 3 of us were Black women, 2 white guys. Everybody else was a white woman. So there had been some changeover in the interest in healthcare, but it was the area, the more I researched it after I got back, I'm like, okay, at that point they were saying you can make $45,000 out of grad school. I'm like, oh my goodness, that sounds like $1 million. Sign me up. But yeah.
That is interesting. Okay, so that's how you end up. And I'm glad that we kind of touched on that because I still don't know that people think about the administrative side of these career fields like healthcare, even like there are nurses who are expert witnesses who their
Yes.
entire career is about, well, you have to get, of course, your practical experience, but it's just another avenue by which you can pursue. Um, I think that it's a good place to talk about the expat experience. The expat experience when it comes to healthcare is very interesting. This is when we're at a time in our lives when anybody says healthcare, our ears perk up. Our ears perk up because it is something that is very, very important to us at this time. There's certain times that healthcare just doesn't ring a bell. Just like for me when I was younger, 401k was like,
Exactly.
listen, I got to buy my groceries. I ain't got no money, but put the money away. How am I put money away? And I don't have enough money, some weeks to make sure I have everything I need. So of course, as you get older, your perspective changes. And so, you kind of picked up on that.
Oh, absolutely. And I think it was us coming to Panama for the number of times that we did. The first time, fell in love, but all we're thinking about at that point is living here. What's it going to be like to live here? When can we live here? Where do we want to live? And that was great. The next time we came back, it solidified. We definitely loved it. But what would it be like to live here? And how would you see family? And, you know, what about healthcare? And how do you make sure that you can access in another country what you're used to accessing in the United States? So it really got me thinking about more at that point, still more along the lines of, I wonder how it works. And your tours were extremely helpful. I mean, having a chance to meet with and talk to the professionals like Dr. Duncan, they answered a lot of questions. And it still at that point didn't resonate quite as strongly because we were so far away from the reality of actually being there. But the more we came and the closer the years closed before we actually moved, I'll be 57 this year. That's exactly what I need to be thinking about.
Yeah.
How is healthcare going to work for us when we move to Panama?
So when you came back in 2024, that's when your wheels started turning. So walk us
Absolutely.
walk us through that. How did you actually get to the place where you are now in your research and inquiry?
You have a lot to do with that because as the entrepreneur that you are, and I am too, but you do it in a way that I can tell you enjoy it. I love what I do for my clients, but I can't do that in Panama. I can't take the perverted healthcare system that we have in the United States that many of us, clinicians included, make a lot of money off of. You can't take that to Panama. Or any other Latin American country for that matter. So I know I wanted to figure out how would I make a living, even knowing by then we're still retired, but what am I going to do to find some joy in how I work, continue to problem solve like I do, and find a solution that still allows me to be in healthcare without, again, bringing the negative baggage of what we have in the United States to other countries. So I started just researching and trying to understand more about what we learned on the tours. Well, what is healthcare like, and what's different about it in Panama than in the United States? And knowing that the costs are lower, you can't make money inside of the providers. I wouldn't want the providers who are already making what they earn on the revenue from seeing patients. They couldn't afford what a consultant in the United States would also earn. So I just started thinking about, well, how could I make money that allows me to not take away from the healthcare and cultural experience of Panama, that doesn't allow me to diminish what happens in the provider community, but adds to the experience of the expats and potentially adds to the experience of the physicians who could serve more expats, specifically Black expats coming. So I just put some things together and reading what I saw on the Facebook pages and the questions that people were asking. I have worked on a resource directory for the state of Ohio. It was my client I won't name the agency, but the state had me create a resource directory, and it was tough. And part of what we learned from that process is how hard it is to keep information up to date, and how hard it is for people to rely on the information that's necessary. One other thing that I'll, without sharing a whole bunch of details, but we had a member of our family who needed immediate care, for some emotional support. And I looked at, again, the resources that we have in the United States, tons of guides, tons of places that you can go online. And when I looked at the particular clinician or counselor that I wanted to see if they would be available to serve our family member, it gave me the 7th floor labor and delivery of some hospital. It had nothing to do with what it's had on the website, you couldn't rely on it.
It was outdated.
So it was outdated. It was not reliable. So it was just those kinds of things together. And then coming back from I think it was February 2024, I sat down and I wrote down every single thing that came to mind, a bunch of questions. Like, what are all the questions that I would want to know as a person who is trying to come to Panama to live? And then how do I get the answers to those questions? So that's what I set out to do.
Well, first of all, you and Will are very, very smart people. And actually, a lot of Black expats, a lot of clients that come on Black expat tours are just like you. However, I don't believe that everybody really thinks through, what will I do in Panama? And understanding that in Panama, you are a foreigner. And the professions, many of the professions here in Panama are protected for Panamanians. So it's very important to kind of think outside the box, to tap in on, what did I see? What did I not see? How can I add to what's already happening there, without taking away from anything? And how can I use my expertise to build new things? This whole expat concept is not something that's going to happen today and not tomorrow. It's going to continue to grow and grow and grow. And the more it grows, the more different industries, including medical and healthcare, see the profit in being a part of that movement, more opportunities will grow for us to, to bring our skill sets to the table.
Absolutely. And frankly, some of that scares me, because I do think there is a possibility that with the growth of Americans moving to Panama and the aging population, we are the fastest growing population, are the baby boomers, and then us to follow. We can't afford to allow the bad stuff that happens in the U.S. healthcare system to be migrated along with the people to these other countries. And I personally don't want any part of that. I want to be able to have an orientation to wellness and well-being. And we don't have to all be chained to our medications and these 5-10 minute physician visits that result in another prescription. Yes. Or you need to see a specialist, or maybe you need this procedure. And then the provider systems who are out there that see these potential trends say, I want to set up shop here and I want to build this. And then the cost will be more. And it could escalate and detract from the experience, that the reasons for us wanting to come to Panama in the first place.
I understand wholeheartedly what you're saying, and it's correct. And I think that even at this point, like if you speak to I've spoken to a few doctors in this area, in this country, and there are definitely people pushing for a more US type healthcare system because it generates more money. I often wonder, and if you could find out, I've always been too shy to ask, how is it that a medical doctor who has gone to school to be a medical doctor to care for people, one of the most important jobs ever, right? Is a doctor, somebody that diagnoses and helps save lives and things like that. How is it that I pay more to go to my nail tech than to go to my doctor? That's the part that I've never understood about here. And I think that that is the part that systems that operate like the United States, which is all on a revenue type basis, could
Yes.
could find a pathway to persuade people in the industry here that they're not doing it the right way and that this is the way that it should be done. So I understand what you're saying.
Yeah. And we could use a redirection. I mean, and it would be to my own demise. If we really were smart about how people needed to be taken care of, you don't need as many people like me trying to nibble around the edges to make healthcare better and have such a niche orientation to what we do that, oh, we need you and we're going to pay you to bring that expertise here. Well, let's just scale everything back to what we're really talking about. And when you really are doing the bare bones, people need to be eating well, exercising, not taking all of the prescription drugs that we take, not having, I remember in grad school at that point, having an MRI in one location in a city seemed excessive. There are MRI machines everywhere inside, a block of healthcare facilities together. And we just have so much redundancy and the expense is astronomical. Those are the types of things that make it super expensive, unaffordable, and unnecessary. But we have a lot to learn and we keep not learning it.
True. Now, and the other thing I want to point out is that when you worked for another company and you created a resource directory, I think that I didn't use that word in the beginning, but that is perfect for what you want to do now. So talk to us about the purpose of the guide and basically how you would go about, putting all of this together to make it work for us.
Absolutely. And I am going to share a couple of slides.
Okay.
And I'll take them down from time to time because I just want to have a conversation about it. But this is the vision, is to create a healthcare guide. I want it to start in Panama because that's where you have allowed me the opportunity to kind of peek under the hood with understanding what the experience is for expats that they've shared on the groups that I've been on the Facebook pages and where people are posting questions. So this is the future. This is not now. What I want to create is a My Expat Healthcare Guide with Panama as the first edition. And I did reserve this myexpathealthcare.org and probably 20 other URLs, again, following your advice and experience.
That's my girl.
You told me. I grab every time a new one comes up, I grab it. So this will give a little bit of the insight to what you're asking, like why the guide, so we can skip all this. But really, it's how people in your network can help me improve the guide that ends up being created. So this is just the background about me. We already talked about that. But this is an example of a question that, after I started thinking about the potential of a guide, I got more and more insight into maybe I'm onto something and this really isn't a bad idea after all. But this is a direct quote from just looking at some of the questions on your Facebook page. Okay. Somebody asked, can anyone recommend a doctor or a clinic in or near Panama City? I got bit by something and I seem to be having an allergic reaction to it. Those are the kinds of questions that people ask. And these are, again, we talked about this. My goal with this guide is to develop accurate and reliable information to help Black expats understand and navigate the healthcare systems and services in Panama, ensuring that they have the support they need in both routine and emergency situations. So I just want to share a couple more of the frequently asked questions that came up. And I must admit, too, that after finding that the questions that I saw on your Facebook page were what they were, I started looking at other Facebook pages, too, that were in other countries, Costa Rica, Panama, Costa Rica, Colombia, and even looking outside of, well, these aren't just questions that Black folks are asking. These are just questions that people have. So looking at other broader expat travel groups, including on International Living, these are the questions that people want to have answered. But just a few, people wanting recommendations on a doctor. What's the quality of healthcare like? What's the cost of healthcare in Panama compared to the US? Can you find an English-speaking healthcare provider? What should I know about health insurance in Panama? This came up in one of the sessions that you had a woman do a great job talking about Medicare and whether or not you can use Medicare and in what situations while you're overseas. How do I handle medical emergencies? What are the difference between healthcare in the US and Panama? And are there any specific concerns for expats? So what I want to be able to do ultimately, and I'm going to stop at this slide for now, is give people the ability to understand how to access public and private healthcare systems in Panama. Make sure that they're able to find reputable healthcare providers and services, help them understand the difference between healthcare in US and Panama, and understanding different options for managing chronic conditions and accessing specialty care. So let me stop with that and see what, because I want to also, this is still part of my discovery journey. I'm learning what I need from these and the other things I'll be asking your listeners and groups to help me.
I mean, I think this is fantastic. And as you were going through that, I was just kind of jotting down the people who would want to be a part of this. And number one would be insurance. Insurance is top of mind for almost every expat, especially every expat that is at the age where we are actually concerned about things going wrong with us physically, even though every expat and every human being should be concerned about that.
Yes.
If you are, we had a couple here and they were, senior age, like a lot of us, and they had a younger daughter. Their younger daughter had extraordinary medical issues while living here in Panama. So just because you're younger doesn't mean that this is not something that you should be pursuing now. And you should be pursuing it now, particularly with the insurance, because it's the best time for you to do it. When you get to be 65 and you decide to make that relocation to Panama or whatever, your insurance is going to look a lot different than it was at 50 something.
Yes, it is.
So you have insurance companies who will want to be a part of this, because as people are looking out for ways to insure themselves and looking at different insurance companies, like, of course, we work with insurance companies, and to look at insurance companies who offer what they offer. There are some insurance companies that don't offer the more aggressive plans that are going to cover people that are at an older age. In Panama, basically, once you hit 70, it's either 70 or 75 for insurance. Pretty much you're not getting it. You are, age discrimination, as we know it in the United States, does actually exist here in a big way. The other group of people that I saw that would benefit from being a part of a resource directory like this is specialists. specialist, because, right now, of course, we work with Dr. Duncan. Dr. Duncan has a network around him. And when people come in, they start with Dr. Duncan, they get their lab work done. He gets pretty much a picture of who they are and what their needs might be medical wise and things like that. If there's specialists that need to be brought into the conversation, he has access to specialists. But what it would be like for specialists to be able to come in and say, here I am, without having to have a specific doctor or medical facility tell people to go to them. For people to be able to just go to a resource and say, these are the cardiologists, or the cardiology specialists within this area, in this region of Panama, and for you be able to decide, like with this resource directory, would it be a situation where users, on the end user part, would we have an opportunity to rate the service that we receive from providers?
I think that's a great question. And this is the reason. So the spoiler alert for this conversation is I need more input on what a useful resource guide would be. And having an understanding of the experience of the user for different providers is vital. Now, I have to be careful because, your experience is your experience. So did you have a bad experience because you're an American and we brought that American attitude and expectation? Or did you have a poor quality experience? And if it was it poor because of potential language barrier? So I think I'm not opposed to that as a potential angle in a guide or a directory, but we have to be careful. And I think to the points that you raised, though, about insurance, if we didn't have in the United States our employers, for the most part, picking the health plans that we could select from, how would we know what we were getting? So when you don't have that and you're trying to go to another country and you're saying, I'm retired, or I know that my health insurance that I have in the US won't transport to another country, I'm going to get insurance in another country. Well, it's not like car insurance where you're saying I'm going to get Progressive or I'm going to get Geico or whatever. You are now in another country having to decide between healthcare organizations that probably have multiple names, operating under corporations that we are usually familiar with in the United States, but operating under a different name once they are in an international setting. And picking the plan and the health insurance company that works for you is going to be a huge undertaking. So what are some of the basic things, whether it's today or 5 years from now? What are the 5 things that you should look for? Those are the types of things I think about when I'm like, what kind of plan do I need? Do I need one that offers emergency or optometry? Is that typical in another country? What happens when I turn 65? Like, there's so many basic things that we should make sure that whether you live there and hopefully before you even get there, you need a basic understanding of what are you getting into. And those are some of the bread and butter of what a resource guide ought to be and do. But then on the side of things that might change, there, one of the areas of research, and when I'm telling you, February of 2024 is when I started my research. I continued that research. I gave myself a deadline of March 31st of 2025. I'm still on that journey. But one of the pieces of information I looked at was the U.S. Embassy has a healthcare resource guide. It's awful and it's out of date and it's a PDF. And the researcher that I had do my the survey that we're going to be talking about, she gave me the example of 20 years ago when she was pregnant with twins, she needed to find an OBGYN. And they gave her the name. She went to that resource, they, meaning the resource, had the name of an OBGYN that she could go to. And when she contacted that doctor, they said, the person who answered the phone said, well, That was my mom, and she's retired. But now I'm in practice. Yes. So there's so many things that a resource guide could provide. But then I need to understand what the value is from different perspectives.
So now, from a Black expat perspective, Latin America, if you're dealing with Latin America, you're going to be dealing with Spanish. Okay? You're going to be dealing with Spanish. I feel like if you move to Panama or anywhere else in South or Central America, you need to expect that you're going to need to learn some Spanish. Okay?
Right.
So I let's just put that out there now. However, where I draw the line is my medical care.
Yes.
I will not accept a doctor who is not bilingual. And not just bilingual, meaning we can get through a conversation. I'm saying I really need you to be able to communicate with me with a full understanding of what I'm trying to tell you, and for me to understand what you're saying to me. Yes. So I think that a resource guide for Black expats in Panama or expats, in general, that language piece, as far Absolutely. As identifying who the provider is, would definitely have to have bilingual for me.
Absolutely.
Definitely. That would be that is my number one criteria
from
in
the front
medical
desk
care
to the everything wrapped up.
Yes.
Agree.
Absolutely. And what I've learned, being in a Spanish speaking country, is that there is one thing to understand and be able to communicate. There's one thing to be able to communicate in English, and then there's quite another level of really understanding what I'm saying. And I experience this in business as well. And I try not to be critical, because I am in a Spanish speaking country that I chose to live in. Okay. Right. However, when it comes to my healthcare, I need to make sure we're on the same page. And sometimes you're just not. You think you are. I think that some professionals and people that you deal with, they want you to believe that they understand a little bit more than they do. And so I think that in a resource, the feedback from clients would definitely be a big thing, because whereas I want the information, like, okay, I don't want to go and to the resource guide and find that the information is 20 years outdated, to find out, okay, well, my mom retired and I'm here for her now, and it's been this way for 10 years. Right. It's like, that's like you're starting from scratch. You're starting from scratch, because whatever was listed about the previous person in charge doesn't necessarily apply now, right? But also for users on the user end to be able to specifically speak about how they felt the understanding of their issues and problems were and what the feedback was is important.
I totally agree. Even having recommendations and referrals, if you had a good experience with someone, promoting those people that you had a good experience with, I would even go so far as to say, if there was and I do this because I do it even at restaurants, I never anymore. I never give a negative review publicly. I'll give a negative review privately because I want y'all to know that was foul. I don't want a free meal. I just want you to know. And if they acknowledge and then can ask or explain, then that's fair. I may or may not give you a second chance, but I at least want to be able to give you the opportunity to understand what the nature of the experience was. So if a directory allowed for, and when I say directory, I'm talking completely electronic. If someone subscribed, and I use that term lightly because I still need to know what is the user experience that we want to have out of here. But maybe somebody wants to say in it anonymously, I don't need to know who you are. I had a negative experience with so-and-so on such and such a date, and here's what the nature of it was. The prudent thing to do would be to research that and to contact that provider and say, hey, here is what was explained, not necessarily putting them on Front Street, but then don't recommend them. Like, don't promote this person, but also don't put them on blast. So I think there's a way to accomplish that. And the other thing, Charlotte, I think it's important. People need to understand what to expect in a Latin American country. Dr. Duncan was very gracious with his time, sat down with me and my husband because I shared this idea with him. And we were talking about calling 911. Now, in the United States, us and our rights, you call 911, you have a right to the call will be answered and someone will be dispatched. That is kind of the law of our land. But when we were talking about it, Dr. Duncan said, you might call 911, but the person picking up the phone might not speak English. And you might not they might not understand what you're saying or vice versa, or whether you're going to get picked up and taken somewhere. So I think those are some of the other just basic cultural norms that people need to understand. If you do go into a hospital, maybe it's common to wait a longer period of time without you complaining. If you're not on death's door, you may not get served in that quick a fashion. So I think there's levels of, provider client experience with a provider, what to expect in certain situations, where to go for accurate information, and in other categories.
I think that's true. And the more you talk, I'm like, yeah, and I'm writing down notes because that is a very good point. And, when people ask, when people from North America, United States in particular, because we are all Americans. We are South Americans, we are Central Americans, we are North Americans. And that is one thing that I really had to grasp being in this part of America. We are all Americans. How we have somehow owned the American title being from the United States is interesting. However, we have an expectation and a guide that says, okay, this is what you can expect. If you go to this hospital, which is registered and known to be a public hospital, this is what you can expect. This is what you can expect to pay at this hospital.
Exactly.
This is the service that you can expect to receive at this hospital. And based on the categories of hospitals, that is huge because you hear people, they say, yeah, well, Panama has public health care. Yes, they do. But is that public health care going to satisfy you?
Right.
Are you going to be okay with what public health care looks like in Panama? Because, really, honestly, Alicia, what does public health care look like in the United States?
So let's do that. Is it a public health insurer or is it a publicly delivered healthcare system? So Medicaid in the United States is publicly funded. It's our tax dollars, but it's not a publicly administered system. The VA, that's a public health system for those eligible to go to the VA. Medicare is a publicly funded health system, but we have private providers who deliver the care. So I that's some of the other thing. I think in Panama, and I'm still learning, in Panama, if health system means it's government run, government operated, government funded, doesn't mean that it's bad, but it might mean potentially that it's not as well resourced. Maybe it's not as flashy pretty as another place, but it doesn't necessarily mean that the quality is any different. What are the credentials of the people providing the care? So I think these are all the things that we just have to be wiser about and not make false comparisons and then make a decision that that's not for me. Maybe it is. Maybe that's exactly where you need to be.
Well, you make a very good point, and you show your smarts. Okay, you're showing your smarts, young lady, because when you mentioned that just because it's a public health system, that doesn't necessarily mean that the people who are serving you are less than qualified. Because what I've learned during listening at our welcome nights where we have the professionals is that a lot of the doctors who work in these more high-end, more, exclusive type treatment hospitals are the same doctors
Absolutely.
that work for the public hospitals. The difference is that they may not have as much time to spend with you as they would in a private hospital where you're paying a lot more to be seen. So that is a very interesting point as well that I don't think that people know to dig into.
Yes.
Dig into.
Yeah. So. I learned a lot from our conversations that we've had on the Beep tours, even in hearing from some of the people, I didn't hear from them, but reading the experiences of people on the Facebook group that just talked about what it's like to spend a lot of time with a clinician and the kinds of conversations that people have. When you are talking to a physician and they want to know, what do you enjoy doing? How do you spend your time? And you're like, what's this got to do with my sore shoulder? Everything. And I've heard you talk about that because I got to get to know you.
And it's something that we don't really get in the US. I mean, no. I don't know who gets that care. I know that me being a middle class North American, I never got that care. I don't know if the 1% gets that care, or people that have more money than I do get that care. But I know that the care that I have received in Panama has been extraordinarily more intense and much more focused on me than any care I've ever received in the United States.
Wow.
And what I can tell you is that the care that I have received in Panama has been extraordinarily less expensive than any care I've ever received in the U.S. I've never had a doctor's direct dial. I've never had a doctor's phone number, which is so common here. So
you have it now, you're saying?
Oh, yes. Oh, yes.
Wow.
You have Dr. Duncan is my primary, and he is on speed dial. And it's not just because I'm Charlotte Van Horn, but all of his clients, we are rotten. Dr. Duncan's client base is almost 100% Black expats in Panama. Whereas Panamanians may or may not be able to really, really appreciate what he's giving because you can get this kind of more hands-on care more readily available in Panama. Black expats in Panama, we like to support, Afro-Panamanians whenever possible. And Dr. Duncan has just been a godsend to us.
Yeah.
We're older. We're concerned about our health, and the other thing is like with this resource guide, would you delve into more holistic?
Absolutely.
Mm-hmm.
Yeah. So I think that's part of the the journey, because again, thinking back to the conversation that you had with Keely Mitchell, I'll call her Dr. Keely,
Mm-hmm.
and she was explaining the factual reality of when people leave the United States and they go to another country like Panama, they actually feel better. They have a better sense of well-being mentally, physically. So carry that through. What does that need to look like? And I want to hear from everyone. And there's some questions in the survey that ask about the extent that there is a level of comfort with just the traditional medical model, a little bit of the holistic healthcare kind of mixed together, purely medical or completely holistic, or some other kind of healthcare journey.
Hybrid. Mm-hmm.
Hybrid, yeah, whatever that needs to look like. Now, my inclination is I would love to have a resource guide more oriented toward the wellness side of things. But if people still are interested in a guide that focuses on the traditional medical model, then you have to provide people what they want. Mm-hmm. But the hope is that they would be interested in moving away from reliance on medications. How can you have a wellness-oriented approach to treating diabetes and hypertension and seeing those results? I have some hopes that people, when they take the survey, can express interest in both.
Well, I think that there has to be interest in both, and that there's going to be interest in both. And I think that from a resource directory provider like yourself, that I would have a whole section for the others.
Okay.
Because it opens up the option. And a lot of us, let's just face it, if you're dealing with expats who are coming from the United States, the whole holistic situation has not been front and center. I'm telling you right now to your face. It's like when I went to my doctor, oh gosh, I used to call him Dr. G, and I liked him. He was a nice guy. Not saying he was the best doctor. But I would go in and man, he would just try to give me medications for anything. Yeah. He would give me, I had something going on. Something was swelling in my foot or something like that. He tried to give me some gout medicine. I said, look here. I'm not taking that. I would tell him, I say, no, Dr. G, I'm not doing that. I had this something going on, wheezing or whatever. He tried to give me an inhaler. I said, Dr. G, I ain't got enough room in my purse for no inhaler. Okay, we're not doing that. But at the end of the day, I was a veteran. I was under Department of Defense medical health care, and it's very easy to get medicine. Medicine don't cost us anything. That part. Medication doesn't, we don't think it costs us anything.
Exactly.
And we don't pay attention to what's being paid for this mess. But I mean, I had to be honest with myself, and I'm like, I'll tell you right now, Alicia, and I'm grateful to God that I am not on
that's awesome.
one medication. I will be, Lord willing, creek don't rise. I will be 61 years old in less than a month, and I am not on one medication, not even. I used to have sinus medication, and I said, why am I taking this every day? Yeah. Guess what? I don't need
you. Don't take it. That's amazing.
I don't take it. So I think that from a Black expat experience, to be able to say, some of us may not even know what certain holistic practitioners are identified as.
Exactly. How do you find them? Yes. How do you know are there variations on holistic medicine? Probably. I'm sure there are strands of that people would want to understand and decide whether it's an herbalist or naturopathy or just exercise oriented. I don't know, but I do want to be able to identify opportunities to meet people's information needs and And also, and just to be really clear, my success as a consultant comes from the clients that I can serve in the United States because of our fractured healthcare system. I'm not trying to earn a living off of this resource directory. I also think that to be useful to somebody, they have to have some skin in the game. If it's free, it's not valued. So there is a cost of finding and keeping information up to date. If somebody said in 2025, the cost of a Medicare coinsurance goes from X to Y, I don't rely on somebody to tell me that. I have a great pool of consultants and research assistants who help me in my regular business, and I pay them for this little side gig that nobody's paying me for. But it's important for me to have, if you've told me that something is what it is, I need to be able to find that for myself. So if Medicare is costing 107 this year and 124 next year, I'm making that up. I don't know what it is.
Mm-hmm.
I need to be able to find that. And the only way to do that is to have somebody dedicated to finding the right information. That's not that's not a ton of cost. I need the cost of the resource directory to be minimal to the user, to the patient, to the person, to the expat who's using it. But who benefits from a resource guide? And we kind of talked about that. The providers in the Panamanian community who get more business. You shouldn't be paying a ton for it either. You should have some skin in the game for it if you want to be featured and show your wares and talk about all the stuff you do. That's not free either. However, if you're a health insurance company, these huge multi-billion-dollar health insurance companies, the type, if I am going to be in Panama before I turn 65, I have to purchase health insurance, especially if my husband's retired and I have a gap. I've got to go to these large companies and I've got to pay them an insurance premium for me to have access to a benefit, or I got to decide whatever the amount is I want to pay out of pocket. But if I'm going to a health insurance company and they want to be identified as, you should buy your care through us, we'll insure you. Well, you can be in the guide and you can help do a comparison of it's you in this other place. What are the differences and what are some of the bonuses that you're willing to offer? Maybe you want to promote a wellness package, but you, insurance company, because they're international, mainly based in the United States and Europe, and some in Asia, you have the wherewithal. So bear the brunt of the larger amount of costs because you're going to get it tenfold, so that the person and the provider can just, again, pay a nominal fee. And don't ask me how much. I'm still working on a pricing strategy. I have no idea. This is all part of my due diligence process.
Well, I have enjoyed watching your due diligence process. You talk about me as being an entrepreneur. I think that what I've learned about you and how you're doing things, I mean, you've invested in this. And like you said, you're not getting paid for this. And that is an entrepreneur in a sense that that especially when it's something that's brand new. When you're bringing something new to the table, there is just something called skin in the game. And that is the price that you pay. But I've seen you hire researchers and people who have an expertise in building out surveys and things like that. And it's been a positive and beneficial experience for me as an entrepreneur to watch. I'm extraordinarily proud of you.
Well, thank you. That means a lot to me. And if I can pick up on the point you just raised, I just want to share how this group can help make the guide useful. So I would love to hear more and get input on what might be useful for a user, or if you happen to be a clinician, what would you find useful in it? So I have 2 surveys, and now that you've corrected me on the American part, I'm going to fess up that the survey title is bad based on what you said. But I would love for folks to share their experiences and insights by completing an online survey. and it will help us identify common challenges and needs within the expat community. And then after that, I'm going to be in Panama May 22nd through the 30th, but I'm going to be holding some focus groups May 23rd through the 29th, and would love to engage in some additional conversations around that. So I have 2 live surveys right now. The first one is Americans living abroad, and it's for those expats. Anybody can take the survey. The questions are not, you can be in any country. There's my researcher, Dr. Amanda Kakowski von Hoppenfels, Amanda KVK, who I learned about through Dr. Keeley, internationally renowned expert on survey design, Harvard undergrad, and she'll have to forgive me where her grad degree comes from, but the best of the best of the best. She created this survey, and she also created the survey, the companion, Americans Thinking of Moving Abroad. These are survey tools owned by me, accessible to me, results not identified. It just helps me understand what needs are. So I'm going to, through Charlotte, be able to disseminate the survey after the posting of this recording. And there's some additional information here around, we only need one person to take one survey. It takes about 10 minutes to complete. It's anonymous. Results cannot be attributed to you. The first 50 people to complete either survey. So the first 50 people to complete the Thinking of Moving Abroad, and the first 50 to complete the Americans Already Living Abroad will receive a $20 Amazon e-gift card within 5 days of survey submission. If you opt to provide additional information, contact information, you'll be entered into a random drawing to receive a surprise gift. These are things, and Charlotte and I talked about this a long time ago, so I won't put you on Front Street completely, but things like an hour-long session with Charlotte, or maybe a session with Dr. Duncan, or maybe a gift card to Topo de Coco or in other places like that. You can skip questions and you can stop the survey at any time, but really encourage you to complete the survey just so that we can understand your needs and preferences and make sure that the guide that ultimately gets developed is appropriate for you. And this is the website, myexpathealthcare.org. And if you mess up and type in some other ones, you'll still likely get to the website. And this is me on our sunset cruise in Panama from last February. So I'm going to close this down and just say I appreciate you so much for taking the time over the last several months talking with me about this. You've given me invaluable insight.
Alicia, I appreciate us doing this because, like I said in the beginning, we've been talking about it for months and months. But I think that we've been talking about it on a more abstract basis for me. And I'm like, yeah, this is really cool. And I'm like, okay, to myself, I don't really understand.
What is she talking
about? I don't really, what's she talking about? But you know what? No, it's like, yeah, I understood the concept, but I think that having this conversation and having you break it down the way that you did and just having this time dedicated, it really opens it up for me. And and I'm happy about that because, I love you to life. I'm so happy that you're doing this, and it helps me to understand ways better that I can assist you in what you're doing. Anybody tell you I was giving a 1 hour consultation? You were just making that up.
Slid that in to see what would happen.
You tried it. You tried it. But that's okay for you, girl. For you, girl. You know what I'm saying. I will definitely be happy to do that. At the end of the day, even with my consultations, it gets to the point where you have to start charging people for things.
Amen.
You have to start charging people for things. But I am always happy to give information. That's why I have so many platforms that I don't have to charge people for things. I'm always happy to give information and inspiration. And so we know where we can reach you. We will get this out, as quickly as possible. But I would just like to give you an opportunity to leave us with, any final thought that you might have for this conversation. It's been wonderful.
I think my final thought is I've spent the last 25 years doing just bending over backwards, doing the best for clients and do it. And I do it well. And I want to put my money where my mouth is and do this well. And all the things that we've tried, I say we as my company is really just me and people I subcontract with. But if I can pull this off, this will be my swan song. I just want to see it work. And I need you and your members and followers, groupies like me, to take the survey, to inform it. And don't settle for, I think I heard, and I might know somebody who knew somebody that told me about. Let's create a resource that is really actionable, practical, and useful. And if we can do it for Panama, maybe there's another country. Maybe there's a Medellin version of this that can come next. So be still my heart. But I just thank you. I appreciate the opportunity. I know you have a huge following. So this is why we have been talking, because you've been incredibly helpful for me shaping out how this could turn out.
And I think it's just it's a wonderful demonstration of how we can work together, help each other, and not step on each other in the process.
Absolutely not. And let just because you mentioned that, we are good friends. But from the very beginning, even though you insisted otherwise, friendship is friendship, business is business. I made Charlotte invoice me for every single consultation conversation we've ever had. And even when she did not invoice me, I would still pay, because this is not, you don't do, you, of course it's fun, but this is your livelihood. And I have to respect you, your hustle, your business, your enterprise. And that is not without much appreciation. So you've helped shape this.
You never take that for granted.
Ways.
You never take that for granted. And I just want to say, I love you. I love you. I love you. There is just nothing, absolutely nothing you can do about it. And I'm looking forward to seeing this grow. I'm so proud of you, sis. Thank you.
Thank you.
Thank you, Alicia. Y'all, I mean to tell you, I'm not even going to lie to you. I was a little bit nervous about this call because, Alicia is such a scholar. She's such a scholar. She's so smart. And I'm so excited about what she's doing, but I didn't have like a total grasp on it. Let me tell you something. I get it. I'm here for it. I'm so excited for her. And it's not like I didn't understand, period, but I just didn't understand totally. But now, having this time for her to go through everything like this, I do. I'm so excited. And something that I really did enjoy about her story was the line that she was in for grad school. And then the guy came and said, "Hey, why don't you come and check out this line?" And she never went back. It's just like amazing because, she never really like maintained the relationship with this guy or anything. And sometimes God will place people in your life just for a season, just for a reason. And I'm glad that he did, because it took her into a whole different track. So I'm appreciative of what she's doing. I thank you in advance for our Black expats in Panama who are living here, who will be a part of the focus group. For those who want to be living here, who'll be a part of the focus group and also part of the survey. I know we're going to get a ton of participation, and I thank you for helping her to make things better for us. Okay, let me see. Definitely, I want to mention our May 18th anniversary birthday celebration. Beep Tours is 4 years old. Charlotte Hickenbotham Van Horn is 61, baby. So you can get your tickets. We're going to have a celebration at Emotions Dinner Theater. We're going to have the PTY Funk and Soul Band featuring La Pana. And we will have the Congo dancers. We'll have an amazing dinner. It comes with a champagne toast, dancing, and just, extra things that you know how we do. So I'm excited about that. Tickets are $50 and they are going quickly. So I hope that you've gotten yours or that you're getting it today or tomorrow. Okay. Um, Also, our tour to Colombia is sold out. Our first cultural relocation tour to Medellin is sold out. It's August 15th through the 20th. I thank everybody for jumping on that so early. For those who are on the waiting list and for those that want to be on the waiting list, I will let you know as soon as we release the next date. For that, we have Brazil coming up 2026. We're going to Salvador. So we're going to the black part of Brazil and we're going to really immerse ourselves in the Afro-Brazilian culture and history. I'm super excited about that. Sisters in Panama, where you at? Probably by the time this is released, our link will be out. The sixth annual women's retreat theme is we deserve ... it, baby. And whatever that it is to you. And we're going to dig into that, but this is going to be more of an elegant tour. So everything is just going to be a little bit more upscale, a little bit more relaxation, and just an amazing time. So that's going to be January 16th through the 21st for that. So those are just kind of some of the announcements that I wanted to make. Please remember that we have on second Wednesday is the Beep B2B Network Meetup. The third Wednesday is Welcome Wednesday, held at Emotions Theater in the Hilton on Avenida Balboa. Starts at 6 o'clock. And then, of course, fourth Sunday is Cafe and Conversation at Granny Vineyard. Starts at 11:30 a.m. It's a brunch type situation. So I just wanted to get all that out the way. I love you. I love you. I love you. There's nothing you can do about it. Stay encouraged and follow our sister Alicia everywhere to see how we can continue to help her grow this resource directory that is going to help us so much. This is Charlotte Van Horn, Black Expats in Panama. Follow us everywhere at Black Expats in Panama. Thank you to my main man, Daryl Spears of Elite Conversation Podcast Media, for just working with a sister for all these years. Thank you, Daryl. I love you, bro. I'll talk to y'all later. Bye-bye.